Welcome to the deep dive. Today we're getting into something that can be pretty worrying for pet owners: facial nerve dysfunction. We see it in dogs and cats too.
That's right. We're working from a detailed veterinary text today, and our aim is really to break down what's happening when this specific nerve, the facial nerve, isn't working properly.
Okay, so the facial nerve, that's cranial nerve 7, isn't it?
Yeah.
What exactly does it control?
It is CNZAS. And well, think about all those subtle expressions your pet makes. The facial nerve handles most of them, moving the ears, blinking the eyelids, which is crucial, moving the lips, flaring the nostrils. It's key for communication.
Right, those little cues we pick up on. The text mentions paresis versus paralysis right at the start. Can you break that down simply?
Sure, paresis is basically weakness. So the muscles can still move, maybe just not fully, or they seem sluggish. Paralysis means a complete loss of movement. The nerve signals just aren't getting through to those muscles at all.
Okay, weakness versus total loss. Got it. And it's not just expressions. There's something about tear production.
Yes, and this is really important. A part of the facial nerve tells the tear glands, the main lacrimal gland, and also a gland in the third eyelid to make tears. If that nerve function is lost, especially, higher up near the brain.
But then tear production can drop.
Exactly. And that leads to dry eye. The medical term is keratoconjunctivitis sicca, or KCS. It's uncomfortable, and it can cause serious eye problems if you don't manage it.
You mentioned dogs and cats. Is it more common in one?
We do tend to see it, or at least diagnose it, more often in dogs, but yep, cats definitely get it too, so this is relevant for pretty much all pet owners.
Good to know. So today's plan is to dig into the causes, the signs to look for, potential outcomes, all based on this expert source material. Where do we start with understanding the dysfunction itself?
Well, the text makes a key distinction right away.
Yeah.
Central versus peripheral causes. This is fundamental for any nerve issue.
Central meaning the brain itself.
Or the brainstem, specifically. That's where the nerve originates. A central cause means the problem is right there, at the control center. Peripheral means the damage is somewhere along the nerve's path after it leaves the brainstem.
Like a problem with the wiring out to the face, rather than at the source.
That's a good way to think about it. So system-wise, we're primarily talking about the nervous system, obviously. But secondarily, the ophthalmic system, the eyes are often affected because of that tear production issue.
Okay. Now, who gets this? We know dogs and cats, but does the text mention specific breeds? Maybe for the idiopathic type, where the cause is unknown.
It does. For idiopathic facial paralysis, which is surprisingly common, certain breeds seem predisposed. In dogs, that's Cocker Spaniels, Beagles, Corgis, Pembroke Welsh Corgis, specifically Boxers, English Setters, and Goldens.
Huh. Quite a few popular breeds.
Yeah. And in cats, the domestic longhair is mentioned. It also typically affects adult animals more than young ones.
Interesting. So for owners of those breeds, maybe something to be aware of. Let's talk signs. What should you look out for?
A key thing the text stresses is checking for full eyelid closure. Can the pet actually blink completely? Sometimes you might need to gently check when they're relaxed.
And with the idiopathic kind, it usually starts on one side.
Yes, typically unilateral. But interestingly, the text notes the other side can sometimes become affected weeks or months down the line. It's pretty rare for it to start on both sides simultaneously.
And if it does start on both sides?
That often signals something more systemic, like a polyneuropathy, a condition affecting multiple nerves throughout the body. So if you see bilateral signs, a full neurological workup becomes even more critical. You have to look for other deficits.
Makes sense. Some signs must be easier to spot than others, like a droopy ear is obvious in some dogs, but maybe not in a cat or a pointy-eared dog.
True. Sometimes the signs are more subtle initially. The history from the owner is really important. Maybe you've noticed your pet is a messy eater all of a sudden, dropping food.
Or drooling just on one side.
Exactly. Or just noticing the face looks asymmetrical, uneven. For the eyes, besides the blinking issue, you might see rubbing at the eye, discharge, maybe even an ulcer forming on the cornea.
So what will a vet specifically look for during an exam?
They'll check for that lip and ear droop, look at the palpebral fissure, that's the opening between the eyelids. It might look wider on the affected side, maybe nostril collapse on that side too.
And reflexes.
Definitely. They'll test the palpebral reflex, the blink when you touch near the eye, and the menace response, the blink to a threatening gesture. Though sometimes, the text mentions, the eye might just retract back instead of the lids closing properly. And, of course, checking if food is falling out of one side of the mouth.
Are there signs that develop later or less common ones?
Yes, in chronic cases, you can get muscle contracture. The muscles on the affected side actually tighten up due to fibrosis, which is like scar tissue forming. That can make the asymmetry permanent.
When the eye issues can worsen.
They can. That decreased tearing can lead to a thick, mucousy, sometimes pus-like discharge. And the cornea being constantly exposed can cause inflammation, conjunctivitis, or keratitis. If the root cause is in the brain, you might see bigger signs like confusion, balance problems, trouble walking, other nerve issues.
The text mentions something about a grinning look, hemifacial spasm.
Ah, yes. Hemifacial spasm. It's like an involuntary, sustained pulling back of the lip on one side. It looks a bit like a grin or grimace. The text links this specifically to possible nerve inflammation neuritis or often otitis media, a middle ear infection. So that sign really points towards investigating the ear carefully.
Wow. And there was another unusual one, intermittent weakness linked to brain lesions on the opposite side.
Yeah, that's a bit more complex. The idea is that the brain normally exerts a subtle kind of inhibitory control. If there's a lesion on one side of the brain, that control might be slightly weakened for the opposite side of the face. When the animal relaxes, this subtle imbalance can sometimes become apparent as temporary weakness. It's not common, but it's a possibility in some central nervous system cases.
Okay, that gives us a lot to watch for. Let's dig into the why, the causes. The text groups them into unilateral peripheral, bilateral peripheral, and CNS. What's in that first group, one-sided peripheral nerve issues?
Right, so unilateral peripheral, the most common cause listed here is idiopathic, meaning we just don't find a specific reason.
Frustrating but common. What else?
Well, there are metabolic causes like hypothyroidism, low thyroid function. Infections are a big one, especially otitis media interna, that's middle and inner ear infection.
Because the nerve runs right through there.
Precisely. Inflammation, too, like polyps in the back of the throat, particularly in cats, or just inflammation of the nerve itself, neuritis. Then there are iatrogenic causes, things caused by treatment.
Like surgery complications?
Yes, ear surgery, sometimes even really aggressive ear cleaning. Certain drug reactions, too, like with potentiated sulfa antibiotics in some dogs.
Okay, what else?
Tumors, unfortunately. Things like cholesteatomas in the ear or squamous cell carcinoma, trauma skull fractures, direct nerve injury, and even toxins like from certain tick bites causing tick paralysis. It's quite a list.
It really is. But idiopathic is number one for the unilateral peripheral type.
By a significant margin, yes. A lot of the diagnostic effort goes into ruling out these other, often more serious possibilities like ear infections or tumors.
Okay, what about when both sides are affected? Bilateral peripheral causes.
Here, idiopathic can still happen. Like with polyradicular neuritis, you might know it as coonhound paralysis. But we also strongly consider immune-mediated diseases, like other polyneuropathies or myasthenia gravis.
Things where the body's immune system is attacking nerves or junctions.
Exactly. Metabolic issues can also cause bilateral signs, sometimes linked to cancer elsewhere, like an insulinoma, a pancreatic tumor causing paraneoplastic syndrome, and toxins again, like botulism.
And the last category, CNS causes, usually affecting one side.
These are problems originating within the brain or brainstem itself. Infections are a possibility, encephalitis from viruses, bacteria, fungi, protozoa. Inflammation like GME, granulomatous meningoencephalitis.
That sounds serious.
It is. And tumors within the brain, primary ones like meningiomas or metastatic ones that have spread from elsewhere like hemangiosarcoma or lymphoma. So distinguishing central from peripheral is really key for prognosis and treatment.
Absolutely. It really highlights how a facial droop could signal so many different things. Does the text mention specific risk factors that might make this more likely?
The main one highlighted is chronic ear infections, both otitis externa, outer ear, and otitis media, middle ear. That persistent inflammation near the nerve's pathway is a definite risk.
So good ear hygiene and prompt treatment of ear infections is important for more than just hearing.
Definitely seems that way. It could potentially help prevent this complication.
Okay, let's talk diagnosis. How does a vet figure out which of these many causes is the culprit?
The first step is critical. Is it one side or both? And are there any other neurological signs? If it's strictly unilateral facial paralysis, no other deficits, no signs of ear disease, then idiopathic becomes more likely, but it's a diagnosis of exclusion.
Meaning you have to rule other things out first.
Correct. You look for clues. Is the animal lethargic? Maybe suggests hypothyroidism. Is there a head tilt? Points towards ear disease. Any mental changes? That pushes you towards thinking about the CNS. It's like detective work.
Does standard blood work help?
Yeah.
Urinalysis.
Often in the idiopathic cases, these are completely normal, but they can provide clues. High cholesterol and a specific type of anemia might support hypothyroidism. Really low blood sugar could point towards an insulinoma, so they're important baseline tests.
Are there more specific lab tests?
Oh, yes. If you suspect something specific, you test for it. You might measure insulin and glucose together for insulinoma, test for acetylcholine receptor antibodies for myasthenia gravis, run a full thyroid panel.
Makes sense. What about imaging? Seems crucial for looking at ears and the brain.
Absolutely. CT scans are generally considered best for looking at the bony structures of the middle and inner ear. MRI gives much better detail of soft tissue, so it's superior for looking at the brain and the nerve itself.
MRI can actually see the nerve.
It can, especially with contrast. And interestingly, the text mentions that in some idiopathic cases, the affected nerve might actually enhance light up on an MRI after contrast is given. The degree of enhancement might even correlate with prognosis.
Wow. What about regular x-rays?
Skull or bulla radiographs are less sensitive, especially for subtle middle ear changes, but sometimes they're a starting point.
Okay, imaging is key. What other diagnostic procedures might be done?
Several things. The Schirmer tear test is fundamental, measuring tear production with those little paper strips. A fluorescein stain on the eye checks for corneal ulcers, which are a common complication.
Right, because of the dryness and lack of blinking.
Exactly. A thorough ear exam with an otoscope, going as deep as possible to see the eardrum. If brain disease is suspected, maybe a CSF tap collecting spinal fluid, ideally guided by MRI findings. And sometimes electrodiagnostics.
Like EMG.
Yes, electromyography can show signs of muscle denervation, confirming nerve damage. And nerve conduction tests can help assess nerve function and pinpoint if the problem is peripheral or central.
So it can be quite a workup to get to the bottom of it. Once you suspect it's idiopathic, what's actually happening to the nerve fibers?
The text indicates that pathologically, in idiopathic cases, you see degeneration of the nerve fibers themselves, both the myelin sheath and the axon, but typically without much inflammation. It seems more like a degenerative process than an active attack.
That's an important distinction. Okay, let's shift to management. How are these cases treated?
Well, for idiopathic cases, it's usually outpatient management. If there's a systemic illness or a CNS cause, the pet might need to be hospitalized initially for diagnostics and stabilization. The absolute priority is treating the underlying cause if one is found.
Like antibiotics for an ear infection or thyroid meds for hypothyroidism?
Exactly. But for the idiopathic cases where we don't have a specific cause,
Then what?
then there's no proven specific treatment for the nerve itself. The text mentions corticosteroids are often used in people with Bell's palsy. That's the human equivalent. But their benefit in dogs and cats is really uncertain. There's no strong evidence they help recovery.
So if it's idiopathic, the focus is mainly on supportive care.
Absolutely. And the number one thing is eye care. Because they can't blink properly and might not produce enough tears, the cornea is at risk.
So lots of eye lubrication.
Yes, artificial tears, maybe thicker lubricating ointments, especially at night. This is crucial, particularly in breeds with prominent eyes, like pugs or Shih Tzus. They're called brachycephalic breeds. Monitoring closely for any signs of corneal ulcers, redness, cloudiness, squinting is essential.
Is surgery ever an option?
If the underlying cause is identified as a middle ear problem, like an infection or polyp that isn't responding to medical management, then yes, a surgery called a bulla osteotomy might be recommended to open up and clean out the middle ear space.
It sounds like owner education is incredibly important here. What do owners need to understand?
Several key things. One, the facial paralysis or weakness might be permanent. Two, although the asymmetry can look worrying, sometimes over time the muscles contract slightly, which can actually make it look a little less droopy, a sort of tuck up.
Okay, that's interesting.
Three, the drooling often improves or resolves within a few weeks. Four, there's a possibility, though uncommon, that the other side could become affected later. Five, diligent eye care is absolutely non-negotiable to prevent serious complications.
And the overall outlook for the pet's quality of life.
That's the reassuring part. The text emphasizes that most animals adapt really well. It's often more of a cosmetic issue for the owner than a major welfare concern for the pet, provided the eye is properly cared for.
That's good to hear. How is the condition monitored long-term, and what's the general prognosis?
Regular checkups are needed, especially early on, to keep a close eye on the cornea for ulcers. The vet will also recheck those facial reflexes, the menace, the palpebral, and look for any subtle return of lip or ear movement over weeks to months.
And the prognosis depends heavily on the cause.
Completely. If you can treat the underlying cause, like an ear infection or hypothyroidism, the prognosis for nerve recovery might be better. For idiopathic disease, though, the prognosis for full recovery is generally considered guarded.
Meaning it might not fully resolve.
Right. Improvement can happen, but it's often slow and sometimes incomplete. Some dogs might end up with a permanent lip contracture or facial asymmetry. The biggest long-term risk is complications from corneal ulcers if the eye care isn't kept up. In really severe non-healing ulcer cases, losing the eye is a rare but possible outcome.
So a real spectrum of possibilities that
Yes.
underscores needing that diagnosis and consistent care.
Exactly right.
Okay, so let's quickly recap our deep dive on facial nerve dysfunction. We've talked about what it is, this issue with the nerve controlling facial expression leading to weakness or paralysis.
We covered the signs, the droopy face, the eye issues being key things to watch for, and the really diverse range of causes, from idiopathic, which is common, to infections, metabolic problems, even tumors.
And we really stress the importance of the diagnostic journey to try and find an underlying cause and how critical supportive care, especially eye care is, particularly in those idiopathic cases.
And I think the main takeaway for you listening is that while seeing these signs in your pet is understandably concerning, many animals do cope very well long term, as long as that supportive management, particularly for the eye, is in place.
Definitely. And maybe a final thought to leave you with. This condition really highlights the body's complexity, doesn't it? How a problem with one single nerve can have roots in so many different systems: ears, metabolism, immune system, even the brain. It just shows why a thorough vet check is so vital for any unusual signs you notice in your pet. Thanks for joining us for this deep dive.